It turns out that chemotherapy and immunotherapy, particularly checkpoint blockade, work reasonably well together. Because of that, the examples I gave you were just from lung cancer, right? So because of that, experiments are being done mostly in bladder cancer now, in which traditional chemotherapy regimens are given upfront with immunotherapy. And based on the lung cancer data, I'm actually sort of optimistic. I mean, I think we're going to see higher response rates. I think we're going to see increased progression-free survival. The question will remain whether we'll see better overall survival or not, but it's actually interesting. I never thought this would happen, okay? The other example I'll give you, because you asked for examples with an S, right? So the other example actually which we thought would work well together was hormonal therapy actually. So hormonal therapy in prostate cancer leads to the gland sort of involuting, and accompanied with that involuting is beautiful. It's an influx of lymphocytes, actually activated lymphocytes. And so it does look like immunotherapy does pair well with hormonal therapy in prostate cancer. We did a trial where we did these things before surgery, and it sort of worked actually. So from the hormonal therapy, we see a nice T cell influx, a nice immune cell influx, and the immunotherapy seems to add to that. So that's another example of a conventional therapy adding to an immunotherapy. I always wonder, actually, just since we're asking questions, I mean, you know, we give hormonal therapy for breast cancer too, and I wonder if that could work in breast cancer as well. I'm not really aware of any experiments or trials in that setting, but I think that's another possibility.